A cancer diagnosis is traumatic, but imagine the day before heading into a potentially life-saving surgery. The insurance company says they won't cover it. That's what happened to one Florida woman, and she is sharing her story with 10 Investigates' Jennifer Titus tonight, hoping to expose a loophole and a decades-old law that's allowing this to happen.
Nobody is ever ready to hear the words, "You had cancer." For Nancy Hutson, she says knowing her family history of breast cancer, she made sure she remained vigilant about preventative care.
In 2024, they found a few more lumps that they hadn't seen before. So we did do some needle biopsies. It ended up being some suspicious tissue, and they decided to do a lumpectomy, which I had in February of 2024.
But 6 months later, a follow-up appointment showed there were new lumps.
The consensus from all of the surgeons was that I should have a double mastectomy.
So she knew she had no other choice but to book the surgery. She was ready. But then she received a phone call the day before she was to head to the operating room.
It is very emotional, to finally make that decision, get all the second opinions, decide that this is the best path forward, only to be, denied the day before my surgery in December was when I found out that I wasn't going to be able to move forward with the surgery.
This is the new Motiva implant that we've talked about.
All because
So what I do is I just fully grab it like that.
of a piece of mesh her doctor, Alicia Billington, uses as part of her surgery.
I just can't find any validity in letting an insurance company express to a doctor what they can and can't use.
But it's not the first time Dr. Billington says she's seen insurance deny coverage.
It's imaging that's getting denied. It's chemotherapy treatment. It's the actual surgery.
Back in 1998, lawmakers passed the Women's Health and Cancer Rights Act. The federal law protects patients who choose breast reconstruction after mastectomy. The problem is the bill was passed nearly 30 years ago. Since then, there's been new surgery options, new advancements, new products like the mesh, which Dr. Billington is pushing to add to the current law.
It says if you have breast cancer, you should be able to have your doctor prescribe whatever care that they think is appropriate, and you should be able to get that done, and you should be able to get taken care of, which is really the heart of what the old bill was. It just adds a couple tweaks to the language.
Language Nancy knows needs to be included. She says she knows she already has one fight on her hands. Battling insurance companies shouldn't be another.
We're making all these great strides in breast cancer research and early detection and how to make it better, and then we don't allow the doctors to do what they know how to do. That's just, again, unacceptable.
Dr. Billington isn't just hoping to make changes to the federal law. She's pushing for added protection at the state level, too. Lawmakers are listening. One representative says she's working on it. We'll, of course, keep you updated. Jennifer Titus, 10 Investigates.